Across oceans and borders, thousands of internationally educated nurses embark on a journey to the UK, bringing with them not just their skills, but their passion, resilience, and dreams of making a difference. Join me as we explore the journey of internationally educated nursing academics, their challenges, and the triumphs right here on Nurses Beyond Borders podcast series. I'm your host Joshi, and I'm thrilled to have you with us. Today, I have the privilege of welcoming an extraordinary guest, Reba. Reba is a passionate and accomplished nursing professional whose journey in healthcare is nothing short of inspiring. Originally from Kerala, India, Reba's dedication to nursing excellence began early with remarkable academic achievements, including securing a state-level second rank and an university second rank during her BSc nursing degree. She further specialized in cardiac nursing with a master's degree, deepening her expertise in cardiovascular care. With extensive experience in critical care and coronary care units, Reba has managed high acuity cardiac patients in complex, fast-paced settings. Beyond bedside nursing, she has played a vital role in shaping the future of healthcare professionals, contributing to nursing education as a part of curriculum research and development team for the Institute of Health and Nursing Australia. In addition, Reba is a certified American Heart Association instructor specializing in basic life support, advanced cardiovascular life support, and ECG interpretation. She also facilitates the acute illness management course called the AIMS course, empowering student nurses to enhance their emergency response skills. Her passion for leadership and mentorship extends beyond the clinical setting. Having actively contributed to the Jesus Youth Movement, a Catholic movement for the service of the church, and served as the college chairperson for the Student Nurses Association, through all her work, Reba continues to bridge the gap between theory and practice, equipping nurses with the confidence, skills, and knowledge to thrive. Reba, it is an absolute honor to have you on the podcast today. Welcome.
Oh, thank you. Thank you, Joshi, for the welcome notes and things. Yeah.
Thanks, Reba. It's really a pleasure to have you in. And I would want to start from where it all started. So what motivated you to choose nursing?
What motivated me? Interesting question. So the first thing, I was really aiming to start to study medicine and all. Okay. But then later I shifted my focus to nursing. Mm-hmm. One main reason why I chose nursing is because my mom is a cardiac nurse, and she used to be a military nurse as well. Wow. Back in India. So her journey kind of inspired me, but then due to the cultural obligations and things, in between she left her career and was fully focused on family. Mm-hmm. But then I thought, if I embark the same journey, I kind of continue. Mm-hmm. And I think I pretty much continued her journey because I also became a cardiac nurse. Wow. And yeah, that's a bit about why I choose nursing. The second obvious reason, it made me feel happy because you are being with people in their most vulnerable moments. Mm-hmm. So you're there for them, when they are in pain and when they feel weak, you're making their lives better, being with them, responding to them. Yes, it's categorized as a job, but still you're helping them in such a difficult situation. And I always remember, a nurse is always there at the start of a person's journey at birth, mm-hmm. and they are also there at the end point when they die. So it's you kind of move through a life cycle of a person. So yeah.
Yeah, that's inspiring, and I can say that you are carrying the legacy of your mother.
Yeah. Yes.
And she should be immensely proud of what you're doing. Yeah. Thanks, Reba. So, you got your education from Kerala, India, and you did your master's in a different part of India.
Yeah.
That is in itself is a big culture transformation.
Yeah.
And then you moved into the UK. Yeah. So that was a massive transformation again. So what made you to take this massive step?
One thing, when we were studying both my bachelorate and master's, both degree, we used to hear quite a lot around like, what are the different roles the nurse can play. So it was on a textual point, it was there. You hear about, advanced nurse practitioner, nurse specialist, nurse researcher. So you come across all these roles. But then when you actually step into the real world of practice, at those times, like, when I completed my master's, it was not very evident. Like, the only thing you could see was registered nurse, nurse in charge, matron. It went like that. But the specialist roles were not existing. So because I heard about all these things, and I knew that, these kind of roles are very prevalent in countries like UK, Australia, Canada, I really wanted to explore these roles and, understand it more better. And I feel back in India, the whole system, healthcare system, is medical led, not like really nursing led. So if you want to implement or bring about a change, or change something, you want to do something, I didn't feel that you have the authority vested on you with the job role you're playing. So I felt like coming to UK will give me that exposure. And also, if you like, I also noticed many of the pioneering works in nursing was mostly from UK, and I felt like UK will be a good ground for me to understand nursing better from a nurse-led point of view.
Yeah, that is amazing. So as you moved into the UK, you started working in the NHS, didn't you?
Yes.
So how was your first day of you being in the NHS?
First day, it felt quite different. Like, I was quite proud about the fact, like, nurse had voice, nurse can express, and nurse can influence the care of the patient. It's not just like, as a nurse, you're following orders of the doctors and executing the orders. You really kind of like, plan the care, and you work in a team, and you're like, you being in the team is valued. You're not distinct, and the concepts like patient advocacy and nurse coordinator, all of those things were like quite evident when I was working here. So I was really happy that, this is what I wanted, and it felt like that.
Wow, great. So what were the challenges you faced, and what were the opportunities for you?
Challenges, I think one, cultural shock. It was a bit like, it was a big transition. And I think in the initial days, I struggled to adjust myself to the weather here. That's something I really struggled. And then then slowly I learned, like, what are the things that people do to manage with the weather, like, taking vitamin supplements, or like, focusing on health and things like that. So I think that was a big thing. But from a professional point of view, what I felt most was, I hold a master's degree, but when I was working in NHS as a registered nurse, I didn't feel that master's degree was recognized as such. They consider you as qualified, but your master's degree, because you took the master's degree from India, was not recognized, and it was not recognized in relation to your job.
Okay.
So I felt like even though I hold that specialist skills and things, that were not fully recognized and fully utilized. And in between, I thought of taking an equivalent certificate, but didn't really go ahead. I thought, like, if an opportunity arises and if it becomes significant, then to go ahead with that. But then when you think in another sense, if you want to further your studies in UK, your master's is recognized. So I think that was a bit of a challenge for me.
It is, your experience or your education, what you built in from back home. When it's not recognized, you need to start from the scratch.
Yeah, exactly.
Yes. I can relate with you. Yes, Reba. So what were the opportunities you saw in front of you?
I felt like, one, the exposure I had with the clinical experience. So I was more focused on, I had a couple of things in my mind really to specialize. One thing, I looked forward for opportunities to specialize in cardiac, and that was one of the focus. Because I have both background of academic and clinic, I also tried to focus on educational roles. Research was more like an interest, not from a career perspective. So I think I was tuned to, like, trying to understand what nursing is here, and trying to get a grip around how it sounds, and how should I build my profile in such a way that, if an opportunity comes that I can grab it straight away.
Yeah.
So I was trying in that direction. So I was more into finding the right opportunities which will fulfill my dreams, but also making sure that I had the ground to apply for it.
Yeah. So did you apply and did you get through that? How was the experience?
No, I predominantly worked as a specialist, a nurse in the cardiac unit and the critical care unit.
Yeah.
I was looking forward to specialize in cardiac if I had a chance, in a couple of years, and then to become an advanced nurse practitioner in cardiology. But then in between, I came across the opportunity of a lecturer post at Salford, and education has also fascinated me all the time. I loved teaching.
Yeah.
So I pretty much gave it a try, and I'm here as a lecturer in Salford now.
Fantastic. That was my next question actually. What made you to move into academia? So what really motivated you to apply for this job and then make this transition?
So one thing is because apart from my clinical experience, I also worked as a nurse educator in a curriculum research and development team. Yeah. So we used to
and that was from Australia, isn't it, the curriculum?
Yeah, we were based in Cochin in Kerala.
Yeah, but you were working for?
Yeah, we were working for IHNA Australia.
Yes.
And we used to follow the framework from APRA, building learning materials.
What is APRA for the audience, please?
APRA is the registration body for Australian nurses. So they set out a framework or a guideline on what need to be at various levels of study.
Yeah.
So we used to follow that framework, something similar to a standard of proficiency for student nurses.
Yes, yeah.
But it was more content focused, they had a clear cut guideline on what need to be included in each of the levels of study and all. So we had to follow that and make sure we adhere to that when we develop the courses. So we developed courses and we developed the learning resources like PowerPoint, slide, multimedia platforms, e-learning, and sometimes publishing the textbooks. But then to work in the background to contribute to that was really amazing.
Wow.
So I loved teaching, and not just teaching, all the work that go into the teaching from the base level.
Yes.
So that was the main reason, when this opportunity came around, I thought, I would like to give it a try.
Yeah, that's great. With your experience, with the vast experience, you've got a clinical experience based in cardiac care, and you've been a big part of the curriculum development as well. So what role do you play in the nursing education in the United Kingdom, and what role do you think you play in decolonization of the nursing curriculum here?
So I think I'm a person who's coming from an international background.
Yes.
And the experience I hold experience both from India and from UK, and both of the experiences.
And a bit from the Australian curriculum as well.
Yeah, because I was developing from a content development point of view and all. I have my head around how the system is actually in Australia, because you have to develop the content tuning to the healthcare system.
Yeah.
So from not directly involved, but indirectly, yes, it gave me a picture.
Yeah.
So I think being all that experience actually contribute when you are actually you're taking that experience into the lectures you take for the students. So you bring that experience into the class, and the students are benefiting from you in a way they are able to hear okay, this is what is existing in UK, but when you look or when you go into India, this is what is existing. And it is not just what is existing in healthcare system, but understanding how the patient population is different, how the socioeconomic conditions are different, how the health demands and health determinants are different. So it's all that. So I think I enrich my lectures in bringing that experience into the classroom, and students most of the time they appreciate that as well. But also I think bringing that experience into the classroom benefit the students in a way that UK is becoming a diverse population. So when they actually step out as a registered nurse, and they start working, their patient population is diverse.
Exactly.
So the experiences we share in the class is kind of help them to equip them in such a way to give more individualized and more person-centered care, to understand the cultural background of the patient population and how they are different between various ethnicities and all. So I think that experience really matters, and also we sharing those experience will start to make them to think like, how people are different and how differently we have to tune to people in order to give the best possible quality care. So.
Yeah, it is embracing the diversity and rendering a culturally inclusive nursing care, isn't it? Yeah. Wonderful, Riba, well said. So, what piece of advice would you give to future nurses or to your younger self?
What I would say is like, nowadays we discuss quite a lot about, because our students, they expect to probably work in NHS when they complete the program.
Yeah.
And then most of the times what we hear nowadays is all the negative aspect of like, staff shortage and the issues and everything. So what I would say, like, whenever you are a nurse, whether it was in the olden days or now, there was issues all the time. Like, it existed all the time. Some of the other issues was there. It was something around your role identity or something around how you cater the needs of the patient or resource allocation. It was existing. It was still there.
Yeah.
But if you keep on focusing on the negatives and expecting change to happen, the change may not happen at all. So, but as a nurse, even though you might think it is too small, you as a nurse can make change, and the change can actually start from you. And many of the changes we actually see around us didn't start on a large scale. It started from one single person who inspired others and made a difference in where they are within their situation and blooming where they were planted. It's more like that. So as a nurse, it's like not losing hope. And I would say like you should be aware about the issues where like in the system, but not to worry about it, but trying to stay focused and stay positive. But also nursing involves both handling of the people. It's quite emotional at times, like the situations we come across. So it's also about like, yes, you contribute as a nurse, you touch lives, you make difference, but at the same time, we also have to think about ourselves, like keeping in mind like self-care is also important if you want to work as a nurse for a longer time.
Yeah, absolutely. Caring for self matters, and the change has to start from us, isn't it? Yes, that's very well said, Riba. So, looking at your profile, you studied from a very reputed institution doing your master's, and moving into the education system here in UK. What are the major differences you see, and what do you bring with your international experience here?
The major difference I see is like, I think, back when I did my bachelor degree, when we say about assessment, it was not just one assessment.
Yeah.
We always had both internal and external assessments, and also things like, we had to submit separate assignments from a lecturer point of view as well. So we had quite a lot from assessment point of view. And the experience also was like, based on what you learn and all. Another thing, like, when I did my bachelorate in India, my bachelorate degree, when I finished it, I was a registered nurse, but I was also a registered midwife.
Exactly.
So it was not field specific. So when I completed my degree, I was exposed to being an adult nursing, mental health nursing, child health nursing. It had components of nursing education, nursing management, obstetrics, gynecology. So it was pretty much everything together. And also so many related subjects you had to learn, like sociology, psychology, microbiology, pharmacology, dietetics, nutrition. Like, there was quite a lot.
Yeah.
So I think in that concept, it's different, because there it is all of it. Here it is like, you're kind of field specific in approach.
Yeah.
So that is a major difference I felt like, between India and here. But then when I studied for masters, they had a bit of a global perspective from an education point. So they used to bring in like, whatever which was existing in India, but also revamping the curriculum in such a way to accommodate what are the good global practices in the Western education system. So like, what I typically remember is like, we know like research is not that focus. It's focused now, but previously it was not that much of a focus when I was doing my bachelorate. But when I did my master's, the institution where I did or the university where I studied, they were like really focused in the research, and they encourage research in both among the students and the staff. And my university was one of the Cochrane hub as well. So I think because I studied my master's in such a university, when I actually moved here and see the education system, I didn't feel massive difference. That exposure really helped me. So to understand both side, like how the eastern and western side of education can change and vary.
Yeah, do you think that helps in you understanding the students who come from different educational systems as well?
Yeah. Yes. I'm still getting my head around how the basic education system works in UK.
Yeah.
But then I think the variation in the difference in my experience I had in doing my bachelor degree and doing my master's was completely different. But that difference I experienced have aided me in understanding my students, how they are looking at things. And also the students we get, we have both international students and home students. So the home students' background will be slightly different compared to the international students. So I think the international background I hold kind of helped me to understand them better and then tune the education and learning in a better way.
Yeah, fantastic, Riba. That was a very thoughtful conversation with you. I would like to end the session with a set of rapid fire questions for you. Okay. So is it a coffee or a tea before a lecture session?
Coffee.
Okay. Are you a night owl or an early bird?
Depending upon the demand, can be both.
That's great. So if you could teach anywhere in the world, where would it be?
Here in UK.
Okay. Is there any specific places?
No, I think I love Salford.
Oh, great. Yeah, okay. Here you go. So what's your go-to stress reliever after a long day?
Being with family, and if I think of a more quieter time, I think I sometimes go for a walk, or if it is a more faith-oriented thing, I'll go for an adoration.
Okay, yeah.
But
yeah, you've got a young family as well, isn't it? Yeah, that's great. And if you weren't a nurse or a nursing academic, what would you be doing?
To be honest, I cannot think anything outside.
Okay.
Maybe I would have ended up in being a bit more artistic side, because I used to engage in extracurricular activities.
Fantastic.
Dancing and singing was not my strength. I was more tuned to elocution and essay and debates and that kind of thing. So probably I would have embraced something in that direction.
Wow. Yeah, that's great. And you have mentioned that you were the chairperson for the Student Nurses Association.
Yeah.
Yes, I know it was a very dynamic thing. I was the vice president for my institution as well. I can relate. Yeah, great. So one thing you would love about teaching nursing?
One thing, I think, I remember last day I prepared a lecture and delivered the lecture, but towards the end of the lecture, the students were really happy. They literally clapped.
Wow.
And I think that is the kind of the feeling you want. You want to keep them motivated, keep them inspiring, and make them hopeful to become a registered nurse. So I think touching, you're molding your future nurses and inspiring and keeping them going. I think that matters most when coming to teaching.
Wow, that's inspiring, Riba. And the last question is, one thing you would want to change in nursing or in nursing academia?
One thing I felt recently is we need to be a bit more cultural competent or congruent. That's something which I think both the staff should understand their student population not just as a student but from a cultural perspective. So they do understand why the students are why they communicate different, why they do certain practices. But I think when students come here from a different background, they also need to be oriented to what the UK cultural expectations are, because sometimes it is important to understand the culture so they struggle less in the initial days.
Yes, yeah, that's very well said. It has to be mutual, isn't it?
Yeah, it should be mutual, yes.
Yeah, that's great. It's been a very wonderful conversation with you, Riba, and a very inspiring conversation as well. Is there any one last thing you would want to tell to the audience listening here in the podcast before we wind up?
one thing I always think is like people forget, like, nurses are there to help them as nurses, but they are humans also. They have their own personal life, and they, I wouldn't say compromise, but they do set aside quite a lot to be with you. And sometimes acknowledging what a nurse is, like, what they are really means a lot to each and every nurse who is around you.
Absolutely, yes. It is an incredible profession as well. And having conversation with you, I think I can go on talking. And I remember we started together in the university as well. So it's been a circle, and I feel it's an immense pleasure, having you as the guest in my podcast series today. Thank you so much, Riba, for this, and I wish you all the best in whatever you do in future.
Thank you.
And so you are listening to Nurses Beyond Borders podcast series with your host Joshi. Thanks for listening.
Thank you, Joshi. Thank you for the invitation and opportunity. Thanks.